In this video, we'd like to come back to a very popular topic, which is chemical pregnancy. Now, don't be fooled by its name. A chemical pregnancy is actually a miscarriage, also known as a biochemical pregnancy, because of certain specific conditions causing the pregnancy to develop into a miscarriage. Now, chemical pregnancy has a reputation to being one of the most earliest forms of miscarriage. It happens so early is that once you find out that you are HCG positive within the second week of pregnancy, this miscarriage happens right in the following week, in the third week or the fourth week of pregnancy, where you don't even have a time to develop it or to let it develop into 1 month of pregnancy, and the pregnancy is already terminated, and this termination happens alongside your menses, your next menses. Normal women who don't have chemical pregnancies, they will continue developing this pregnancy. They can continue to sustain this way past their usual menses, and then they will develop into the first trimester, second trimester. But people who have this condition is that, let's say you are found out to be pregnant within the first week of the month, you will usually end up developing this chemical pregnancy where you usually have your menses, usually on the third or fourth week, which is why this type of chemical pregnancy is the fastest form of a miscarriage. So fast is that it's very common to have misdiagnosis. A lot of doctors will think that you might not even have had a proper pregnancy. You may not even be able to consider this a pregnancy because it didn't even develop a miscarriage so quickly. But we need to know that chemical pregnancy is definitely not an infertility condition. So a lot of doctors would recommend infertility treatment methods such as IVF or IUI to treat a chemical pregnancy. But what ends up happening is that these patients put in so much money and time, and they end up still miscarrying despite following the doctor's advice, because IVF only treats infertility, but chemical pregnancy is not infertility, it is a miscarriage condition. So the root cause of why the miscarriage happens so quickly is because this is the endometrium here, and it has two layers here. So one is the functional, one is the basal. This is inside your uterine cavity, and this is where your pregnancy will implant itself during the first few weeks of pregnancy. It wants to implant within the first week of forming the zygote. So it will implant. Ideally, it will implant all the way into the basal layer. This is how a healthy pregnancy will develop. Very secure and will unlikely to result in any form of pregnancy complication. But for a chemical pregnancy, this implantation only happens in the functional layer of the endometrium. It happens very shallow, causing it to be very unstable. So any types of disturbances or uterine contractions, or even shedding of the endometrium during menses will cause it to be terminated, leading to a miscarriage. So these types of shallow implantation leads to very low HCGs. This is a very distinct diagnosis that we need to do, but it is happening so early. So we recommend patients with this type of history to go for a HSG or check for the presence of anti-embryonic antibodies. These are the two common causes for a chemical pregnancy. Either you have some form of uterine malformation causing the pregnancy to implant very shallowly, leading to this early miscarriage, so early that it happens within the first month, or you have very high presence of these antibodies, anti-embryonic antibodies. Very high presence, which is what's causing it to happen so quickly. So, in other words, we can also consider a chemical pregnancy to be an immunological miscarriage. Here at Antai Hospital, we offer a full contractual treatment to treat your chemical pregnancy if diagnosed properly. So we'll either have you to do a HSG to determine is there uterine malformation, and also most likely you have the presence of these antibodies, both of which we can actually accurately diagnose and treat. To find out more information, please visit our website and also leave a comment down below for me.